Right now, they strive to make a difference in the lives of others. Innovative healthcare delivery supports over 500,000 lives nationally, including right here in the Silver State. And here with how they do that exactly is Shelley Lara. She is the president and CEO. It's great having you.
Thank you.
So let's talk about this organization. You use community health workers to assist people when they're being discharged from the hospital or having a surgery. Tell us what your company does.
So just that in a nutshell. So when our patients are admitted into the hospital, we go to visit them bedside primarily. It's really the core values of the program is developing a relationship with patients. So when we go and see them in the hospital, we're not just kind of checking a box. We're talking to them about, oh, you're a Broncos fan, I'm a Raiders fan, and really kind of creating that bond so that when they're discharged from the hospital.
I don't know if that creates a bond, by the way, Raiders and Broncos.
Well, they remember us when we call them afterwards,
yes,
is what really happens.
And this is pretty valuable, because sometimes you go into the hospital sort of situation, you can kind of feel like a number or a little checkbox. So to have that human interaction,
it's huge.
Is huge. How does that service end up affecting people on a personal level?
In a huge way. So I think that not intentionally, but the clinicians are so bombarded with their patient caseload. So when our patients get discharged from the hospital, we're able to really wrap our arms around them and take them through the continuum of the healthcare setting for 30+ days.
Wow.
So we're helping them get their medications, driving them to their doctor's appointments, making sure all their records get there. And we take care of Medicaid patients, Medicare patients, union patients. So each patient's needs are unique, and we are making sure that they get what they need so they can get better and not have to worry about all of those boxes that need to be checked.
And your organization was founded 6 years ago. Now you're working with 500,000 people nationally, which is incredible, including right here in Southern Nevada. Do you have any examples or stories of people that you've helped here in Southern Nevada?
Yeah, just this year we've taken care of almost 18,000 people just in the state of Nevada. And so we are contracted with Amerigroup, which is a Medicaid plan here, as well as Renown Health up north. And so we take care of both Medicare lives and Medicaid, as well as several union plans in the state of Nevada. This is where we started, and so our heart is here. And like I said, each patient is really unique. You can have a plumber that gets discharged from the hospital who wants to get back to work, and therefore he's not going to pick up his medications and he's not going to go to the doctor, which both of those things lead to him getting right back readmitted to the hospital. Where on the flip side, you might have someone who doesn't have a home, and while we're working with them and delivering their medications under a bridge, because that's where they live, it takes a few days to get them into housing. We've placed almost 1,000 members into transitional care housing or permanent housing just this year.
It really is. It's kind of like concierge care, pretty much. It's pretty incredible.
Really advocacy on steroids, I guess.
Like, there we go. Except no steroids, unless, of course, prescribed by a doctor.
Exactly.
A legitimate one, not you, Conseco. IHD, where are you seeing this go in the future?
I mean, we're growing, and I think that the healthcare industry realizes that non-clinical advocates is part of the way of the future. We're not replacing anything that exists today. We're another tool in the toolbox that's needed. And so we've made a big dent in the healthcare setting, and we'll have a national presence by the end of this year.
Because the work that you're doing doesn't only affect the patient, it also affects the caregivers as well at these hospitals.
Absolutely.
It's not necessarily one less thing they have to worry about. It's a thing that they know they'd like to do, they can't because they're so inundated.
Absolutely.
That they know is being taken care of.
Yeah, I myself have experienced the healthcare setting, and it's scary, and I consider myself someone who's knowledgeable of the system, and when you become sick, all of that goes out the window. You forget the questions to ask. You get home, your morphine fog is wearing off. Everyone's calling you, asking you questions, and you literally don't know what to do. You should be able to just recover and have someone there to take care of all those things for you.
So how exactly does it work if you are a patient? How do they connect with IHD to have them come in and take care of things? Is there a certain way, or is it kind of out of our hands?
We connect with them. So if you're our patient through a client that we're contracted with, as soon as you hit the hospital, we're made aware that you're there, and we show up bedside and tell them, hey, we're here for you, and we're going to be with you through this ride.
There are certain things, I mean, of course, the home placement, even just getting the medication.
Yes.
There must be such a burden lifted off the shoulders of some of these people.
Huge transportation issues, multiple pharmacy errors that don't need to happen. People think they have co-pays that they don't, so they don't pick up prescriptions. Probably one of every 5 discharges has medication barriers that are huge.
Wow. It's incredible. If people want to learn more about IHD, how do they do so?
They can go to our website, www.ihdcare.com, and or email us at info@ihdcare.com and learn more about how they can help our patients or become a member of our team.
I love this. Can I do it? I mean, can IHD follow me if I'm not in the hospital? Can you just help me with stuff? Because that'd be great.
Yes.
You're just have you around. Like, listen, can you pick this stuff up? I don't have the time. It'd be phenomenal. It's great having you. Thank you so much. You're doing some great work, and 6 years and over 500,000 people is really incredible. Congratulations on that.
Thank you very much.
You want to learn more about innovative healthcare delivery, you can do so by visiting the website you see right there on your screen. You could call the 1-800 number there as well. Innovative Healthcare Delivery is a proud sponsor of the Morning Blend. Really, really incredible stuff there. We've all been to the hospital. We know we got a laundry list of things we got to do. To have somebody in your corner to help you, that's pretty awesome.